Hello guys, welcome back to my YouTube channel. In case this is your first time of coming across my video, you're welcome. Believe you me, you're not going to regret it. And if you haven't subscribed to my YouTube channel, please do so for more educative, entertaining and informative videos. So today's topic is glycemia. Before I proceed, please make sure you stay till the end of this video, because you're going to learn one or two things. So today's topic, like I said, glycemia. What is glycemia? Glycemia is the presence of glucose in the blood, and glucose in the blood is very essential when it is in normal range. And the normal range of glucose level in the blood is 70 to 110 gram per DL per deciliter for fasting blood sugar. But for random blood sugar, that is the blood sugar that you check when you must have taken your meals, the normal range of it is 70 to 130, or some may say 140 milligram per deciliter. Blood sugar is very essential. Glucose is very important in the blood, in the body, because our brain uses glucose for it to be able to function well. Then this glycemia is of two types. What I mean of two types is depending on the range. When it is high, it is termed hyperglycemia, and that is when the blood glucose is very high. That it proceed or is exceed to above 140 milligram per deciliter. It exceeds that normal range for random blood sugar. Then for fasting blood sugar, when you check your blood sugar, when you must have not taken your meal, your breakfast, and you check your blood sugar and you notice that it is above 100, that is hyperglycemia. Glycemia, like I said, it is the presence of glucose in the blood, and when it is high, it is termed hyperglycemia. That is when the blood glucose level is high. It is termed hyperglycemia. Then when it is low, when your blood sugar level is too low, below 70 milligram per deciliter, it is termed hypoglycemia. And these two conditions, that is hypoglycemia and hyperglycemia, is so bad in the system. So in this video, I'm going to tell you the risk factors of this, or the adverse effect of this hyper and hypoglycemia. High blood sugar wreak havoc on our health, and one of the adverse effects of it is that it interferes with our immune function. That is, It gives our body the chance of having so many infection or illness. That is what I mean by interfering with our immune function, decreasing the body immune system that should have helped to fight infection. So when one has this high blood sugar for a longer time, not just for a moment, for a longer time, it has a way of reducing our immune system in order not to be able to fight infections or other diseases. Again, is that it increases the chances of obesity when one have this high glucose level in the blood. Another thing it does is that increases the chance of obesity, diabetes, heart diseases, and many more. Even aging. Anyone that has this diabetes usually age faster. And we know what is diabetes. Like I said, hyperglycemia, when there is increase of glucose in the blood. So this hyperglycemia and hypoglycemia, I'm going to take it one after the other. Hypoglycemia, like I said, is when the blood glucose is low. Symptoms include anybody that have this to be sweating. Then another one is pallor, that is looking unhealthy, having an unhealthy pale appearance. Another one is lack of coordination. Yeah. Another hunger also. If you have low blood sugar, you'll be feeling hungry very well. That is often. So these are the symptoms of hypoglycemia. Now, what causes this hypoglycemia? Medication of most times. Medication. So medication can cause this hypoglycemia. So that is why I usually say, make sure you don't give yourself self-medications. If you find out you're having some health issues, you seek for medical professionals. So taking medications, most medication can cause hypoglycemia. Another one is skipping of meals, not eating balanced diet can cause this hypoglycemia. Then the risk factors of this hypoglycemia is that, like I said, our brain needs glucose level to function well. But when there is low glucose in the blood, one will have disorientation, lack of coordination, lack of consciousness, coma, and sometimes death. So that is why it is very imperative to treat this hypoglycemia. And how do we treat it? We treat it by giving anybody who is having these symptoms a fast-acting carbohydrates, such as glucose gel or any glucose drink, soft drinks, sweetened fruit juice. Then eating this simple carbohydrate food like rice, yam, and others. Then another thing to note is that whoever that have this hypoglycemia should not be taking protein, any food that contains protein, because protein reduces or slow down the absorption of carbohydrates in the blood, in the body. So when you are taking this, when you're having any patient who have hypoglycemia, it is very important you tell the person, or if you are the one, it's very important to avoid proteinous food, because it slows down the absorption of carbohydrates in the body. It's very important to note that. Then let's talk about hyperglycemia. Hyperglycemia is when the blood glucose is high. What causes this? The cause of this also is linked to infection, some illness, some medication. Then when there is family history of diabetes, then too much consumption of carbohydrates food, when the body is not producing enough insulin, or when the body is not using the insulin properly. Symptoms of hyperglycemia include dry mouth, weakness, blurred vision, frequent urination, increase in thirsty. You'll be feeling too thirsty to take water. Then the risk factor of this hyperglycemia, when untreated for long-term hyperglycemia, it causes problems at the extremities, such as the hands and the feet, and it also causes problem at the joints and bone. Then sometimes blindness, cardiac disease, kidney failure. So these are the risk factor of hyperglycemia for a prolonged term condition. So how do we treat this hyperglycemia? Normally hyperglycemia can be acute. So in an acute patient, it's an emergency situation. So in this emergency situation, what can be done is giving the person some fluid, electrolytes, replacement of electrolytes, then insulin therapy. But for a person who have a long-term health condition, that is chronic hyperglycemia, it can be manageable. You see your physician. The physician will keep you in diet. There will be regular check of your sugar level, so that it will help you to keep it in check, or if to fall within normal range. Then we have we'll be taking your insulin, because insulin is a hormonal medication given to people who have this hyperglycemia or diabetes, to help them to reduce the level of glucose in the blood temporarily. It's not just permanent, it's temporarily. Then your physician will tell you the type of exercise you'll be undergoing, because you have to be fit, you have to be exercising, so that it will help your metabolic system. Then another one is eating of healthy diet, especially reducing your intake of carbohydrate food or any sweetened drinks. So all this I said are the way you can manage a long-term health condition of hyperglycemia, which is diabetes. Then at this juncture, we are bringing it to an end. Thank you for watching and stay cool. Bye.
Subscribe, like and share.